In our continuous journey towards maintaining health and preventing disease, the power of knowledge cannot be overstated, especially when it comes to identifying the early signs of a stroke. It's imperative to understand that strokes do not occur without warning. In fact, the body often sends out signals well in advance, signals that, if heeded, can drastically alter the course of one's health for the better. This video not only uncovers the 9 critical warning signs that could manifest 30 days prior to a stroke, but also delves into the importance of recognizing these signs as part of a broader strategy for stroke prevention. We'll explore the science behind these indicators, offering insights into how they relate to your overall cardiovascular health. Additionally, we emphasize the importance of regular health checkups and adopting a lifestyle that supports heart and brain health. By equipping yourself with this knowledge and sharing it with those around you, you're not just protecting yourself, you're contributing to a culture of health awareness and prevention. Join us in this vital video until the end and take proactive steps towards a healthier, more informed future. Number 1. High blood pressure. The heartbeat pushes blood against the artery walls. This pressure, when too high, is called hypertension and is the main cause of stroke. A normal blood pressure is around 120 to 80 millimeters of mercury, but readings consistently above 140 to 90 millimeters of mercury indicate hypertension. This condition signifies more than just numerical values. It signals that the heart must exert extra effort to maintain blood flow, which in turn can weaken arterial walls and accelerate cardiovascular issues. High blood pressure increases the likelihood of clot formation or plaque detachment, potentially obstructing cerebral blood flow, elevating stroke risk. Factors contributing to hypertension include genetics, aging, lifestyle choices, and diet, highlighting the complexity of its causes. However, there's empowering news: blood pressure can be managed. Proactive monitoring, lifestyle adjustments, and regular medical consultations can significantly mitigate this risk. Embracing a healthier lifestyle, such as engaging in physical activity and maintaining a balanced diet, proves instrumental in controlling blood pressure levels. Number 2. Fatigue. Fatigue, characterized by a pervasive sense of exhaustion, may serve as an unexpected indicator of an impending stroke, warranting attentive examination. This symptom transcends mere tiredness, acting as a critical alert from the body that an underlying issue may be present. Factors such as insufficient sleep, excessive physical or emotional stress, and an imbalanced diet can disrupt the body's equilibrium, subtly undermining one's health. These disruptions not only contribute to the sensation of fatigue but also potentially elevate stroke risk by impacting the cardiovascular system's efficiency and resilience. Recognizing fatigue as more than a transient condition, but rather a possible prelude to more serious health concerns, emphasizes the importance of holistic well-being practices. Addressing lifestyle factors, ensuring adequate rest, managing stress, and nurturing a balanced diet are essential steps in mitigating stroke risk and enhancing overall health. Number 3. Vision problems. Vision problems can act as critical indicators of an impending stroke, serving as the body's warning signal of potential cerebral blood flow complications. These visual disturbances, ranging from blurriness to double vision, or even the sudden onset of partial or complete vision loss in one or both eyes, should not be overlooked. They underscore the urgency of addressing circulatory issues that may impair the brain's blood supply. Such symptoms necessitate immediate medical attention, as they reflect the broader implications of restricted blood flow to the brain, which is essential for its function and overall health. Number 4. Sudden headaches. Sudden, severe headaches serve as a critical alert from the body, signaling potential serious health issues, including the risk of a stroke. Headaches vary widely in their intensity and cause, making it crucial to discern their origin. When additional symptoms accompany a severe headache, it usually indicates a more serious problem. This combination of symptoms can be interpreted as the body's coded message, hinting at underlying conditions such as a stroke. The link between intense headaches and strokes is a critical piece of knowledge, emphasizing the importance of not dismissing these warning signs. Prompt recognition and action in response to these signals can be life-saving, underscoring the necessity of understanding and heeding our body's messages. Number 5. Numbness or weakness in limbs. Experiencing numbness or weakness in the face, arms, or legs can signify more than a transient issue. It's particularly concerning in the context of strokes. While conditions such as pinched nerves, arthritis, and carpal tunnel syndrome commonly cause these symptoms, the presence of numbness and weakness could also indicate a stroke. Understanding the connection between these symptoms and strokes is crucial. If these sensations occur with other symptoms of a stroke, it's a critical warning that demands quick action. Recognizing these symptoms as part of the body's warning system can lead to prompt medical intervention, potentially averting the severe consequences of a stroke. It's essential to be vigilant and responsive to these signals, as they can be pivotal in identifying and responding to a stroke's early onset. Number 6. Difficulty speaking. Difficulties in speech should not be underestimated, especially as they relate to strokes. These issues serve as significant indicators from the body, suggesting potential complications within the brain's functioning. Symptoms such as stuttering, slurring of words, or difficulty in choosing the correct vocabulary are crucial clues. Understanding the link between speech impairments and the heightened risk of a stroke is essential. When these speech difficulties occur, especially alongside other stroke warning signs, it acts as an urgent nudge for immediate action. Recognizing and acting upon these symptoms promptly can be critical in managing the situation effectively. It's a call to be vigilant and seek medical attention without delay, emphasizing the importance of a quick response to such neurological warning signals. Number 7. Memory problems. For many, experiencing memory lapses is often dismissed as a natural aspect of aging. However, groundbreaking research from Erasmus University Rotterdam, featured in the Stroke Journal, challenges this notion by highlighting a potential link between memory loss and the risk of stroke. This study presents compelling evidence that memory impairment may serve as an early warning sign for stroke, especially in individuals with advanced educational backgrounds. The findings underscore the importance of monitoring cognitive changes as part of stroke prevention strategies, suggesting that memory loss, rather than being an innocuous symptom of aging, could be indicative of more serious underlying cerebrovascular issues. Number 8. Loss of balance. Loss of balance is a critical sign that may indicate an impending stroke, highlighting potential damage to the brain's coordination center. This vital area of the brain integrates sensory information with motor functions to facilitate coordinated and fluid movements. Disruptions in balance can arise from a variety of issues, such as complications within the inner ear, which plays a pivotal role in maintaining equilibrium, muscle weakness that affects mobility and stability, or adverse reactions to medications. Understanding these factors is essential, as they underscore the interconnected nature of our bodily systems and their role in overall motor function. Number 9. Nausea and vomiting. Nausea and vomiting are often overlooked symptoms that could indicate a looming stroke, primarily because they reflect disruptions in cerebral blood flow. The brain's dependency on a steady, regulated supply of oxygen and nutrients is critical for its functioning. A stroke, characterized by an interruption of this vital blood flow, can precipitate a range of neurological symptoms, with nausea and vomiting among them. These symptoms emerge as the brain's distress signals in response to the compromised delivery of essential resources. Current scientific evidence does not support the existence of specific precursory signs that can predict a stroke months in advance. However, there is a consensus on several risk factors known to significantly increase the likelihood of a stroke. These include hypertension, high blood pressure, the use of tobacco products, diabetes mellitus, elevated cholesterol levels, and various forms of heart disease. Proactive management of these risk factors, through medical intervention and lifestyle modifications, is crucial to reducing the risk of stroke. Adopting a health-conscious lifestyle, which includes a balanced diet, regular physical activity, and avoidance of tobacco and excessive alcohol consumption, plays a vital role in stroke prevention. Moreover, the emergence of acute symptoms such as speech impairments, sudden numbness or weakness in the face, arms, or legs, and severe headaches requires immediate medical evaluation. These symptoms may indicate the onset of a stroke, highlighting the urgency for prompt medical attention. Quick response to these signs can be critical in minimizing the long-term impacts of a stroke and can potentially save lives. Thank you for dedicating your time to view our informative video. If you found the insights on stroke prevention beneficial, we encourage you to share this video with friends and family to extend the knowledge that could potentially save lives. Please remember to like our video and subscribe to our channel for early access to invaluable content on health and nutrition. We are committed to your well-being and aspire to contribute to your health, safety, prosperity, and happiness through our content.